Welcome to day 2 of Hurricane Katrina to Paradise Wildfires, exploring themes in disaster human services. A workshop hosted, next slide, and next slide. A workshop hosted by the Forum on Medical and Public Health Preparedness for Disasters and Emergencies of the Health and Medicine Division of the National Academies of Science, Engineering, and Medicine, and supported by the Administration for Children and Families. Thank you to attendees, speakers, planning committee, and staff. We have a great slate of panelists on our agenda who will be sharing with us today. Speaker bios will not be read in full, but they have been provided in the briefing book. We invite all audience members to engage in the workshop activities. You can engage in the discussion with other audience members in the chat box. We will also be sharing resources mentioned by the speakers there. So let's practice that. If you haven't done so already, please share your name and location in the chat box. The chat box will be monitored by National Academy staff. Please submit questions for the speakers and panelists in the Q&A box. The questions will also be monitored by the National Academy staff. And if you have any technical issues, please let us know in the chat box. Look for IT support in the chat list and they will help you. This workshop is being recorded. Please make sure to identify yourself, name, title, and affiliation when you provide questions. A workshop proceedings, which is a reasonably accurate and objective summary of what occurred at the workshop, will be authored by a rapporteur with the assistance of Academy staff. The proceedings may contain particular viewpoints attributed to individual participants or groups of participants in the workshop. The workshop is designed to meet the following objectives. Next slide. Understand the critical child infrastructure, for example, the existing systems and networks of human and social services that serve children and youth, and how it functions, how services are delivered before, during, and after a major federally declared natural or environmental disaster. Understand the impact of disasters on children and youth that benefit from human and social services providers. Understand the current gaps and future opportunities for supporting the coordinated delivery during the restoration of services following major federally declared natural disasters. And finally, to explore potential matrices for evaluating response and recovery efforts related to human and social services. Next slide, please. The workshop theme was developed prior to COVID-19, and so our scoping is specifically related to natural and environmental disasters. We are looking at children and youth ages 0 to 26, specifically people already receiving public support, so people with pre-disaster socioeconomic deficits. The rationale for not focusing on COVID, but is specifically because we know that natural disasters and environmental disasters continue to occur. And we also know that we have gained a lot of experience from those disasters. And we hope that through these panels, people will hear about where we were and where we have come to, and see that progress is being made and that there are many lessons to learn from what has happened before. Natural hazards are not standing still while all of this is happening. We will still have wildfires. We are approaching hurricane season, and we know how this goes. The workshop will focus on disaster response conditions and transition to reconstitution of routine services delivery programs by state, local, and territorial human, social services, and public health agencies. The workshop will prioritize programs that are under the auspices of the Administration for Children and Families. It will also look at promising practices, ongoing challenges, and potential opportunities for coordinated delivery and restoration of human and social services. And the workshop will identify and review current practices for the assessment and evaluation of outcomes during the transition from response to recovery. Next slide, please. Before we move to panel one, I wanted to quickly recap day one. Day one, the Principal Deputy Assistant Secretary, Scott Lee-Kahn, and the Director of the Office of Human Services, Emergency Preparedness and Response, Natalie Grant, welcomed us and provided us with an overview of the ACF mission and the role which stemmed from the 2006 White House report on Katrina. The goal is for us to initiate development of a body of knowledge for disaster human services. Our first panel was on critical child infrastructure and included Josephine Bias-Robinson, who is a board member of Life Pieces to Masterpieces and a former ACF senior administrator during the Bush administration, and Deborah Bergeron, who is the current director of the Office of Head Start and Early Childhood Development. They discussed the structure of ACF programs during Katrina and as they are now, including the essential role of some of their block grants following a disaster. It gave the audience a better idea of the programs and infrastructure that exist pre-disaster and how they interact and adapt during and after a disaster. Panel two looked at the impact of disaster on critical child infrastructure and included Trevor Riggins, the Vice President of Disaster Cycle Services at the American Red Cross, Laura Lee Koziol, the National Advisor on Children in Disasters at FEMA, David Markison, the Director and Medical Director of the Center of Excellence in Precision Response to Bioterrorism and Disasters, and Shannon Christian, Director of the Office of Child Care at ACF. We learned that any child care grantee must have a disaster plan for preparedness, response, and recovery, but also that many child care centers close during a disaster, sometimes being ordered to do so, and other times at the concern of parents. We heard about the challenges in the pediatric healthcare system, and especially as it relates to reunification, social support services, and resources. And then we heard what I remember as the takeaway for the day. Our children are the best opportunity to change the way we prepare. In the afternoon, we had breakout sessions on case studies and the impact of disasters on specific populations, including the impacts on youth, parents, children with complex special needs, and unaccompanied minors. These sessions not only identified needs, but needed infrastructure, planning, and response capabilities. Then we ended with an enlightening keynote by Lori Peak, who gave us a call to action that we need to know children's voices, perspectives, creativity, and rights. She also stressed the importance of research to identify and fill the gaps. Lori Peak briefly mentioned the work of the National Commission on Children in Disaster, which left the planning committee thinking we should highlight some of the progress that has been made. So let me give a few examples. Some of the recommendations that there have been significant progress made on, and I know there are others, but I am focusing on some of the human services one. Recommendation 2.3 was that federal agencies and non-federal partners should enhance pre-disaster preparedness and just-in-time training in pediatric disaster mental and behavioral health, including psychological first aid, bereavement support, and brief supportive interventions for mental health. And individuals such as teachers who work with children. And we know that psychiatric first aid has been very successful, and it's now taught across the country. Organizations like Children's Bereavement Center in South Texas work with organizations like FEMA and the American Red Cross to provide support for children after a disaster. Recommendation 5.1, disaster case management programs should be appropriately resourced and should provide consistent holistic services that achieve tangible positive outcomes for children and families affected by disaster. And we know that the disaster case management program at ACF has now been operated for over 10 years. 6.1, Congress and federal agencies should improve the capacity to provide child care in the immediate aftermath and recovery from a disaster. And after Sandy, finally, after Sandy, it became a requirement for child care providers to have disaster plans. 6.2, Congress and federal agencies should improve capacity to provide child care services in the immediate aftermath of the recovery from disasters, including codifying child care as an essential service of government nature. And we know that childcare is considered an essential services in some states, such as New York. And then HHS should require disaster preparedness capabilities for Head Start centers and basic disaster mental health training for staff. And we know that in 2009, Head Start published its first emergency preparedness manual and has updated it and put out many more resources since then. And that FEMA has an emergency preparedness for Head Start site that I've listed the address for. Next slide, please. But we still have room for improvement to ensure that school systems recover from disasters and provide immediate resources to reopen and restore the learning environment in a timely manner and provide support for displaced students and their host schools and fund it. And it goes on to explain all the funding. And we know that there is a lot of work we still need to do with our schools, especially those schools that serve poor and underserved populations. And then 8.2, ensure that state and local juvenile justice agencies and all residential treatment, correctional, and detention facilities that house children adequately prepare for disaster. These are just a couple of the areas that progress has been made, but more needs to be done. Next slide, please. And so one of the things you think about when you think of critical infrastructure is what the government identifies as the sectors of critical infrastructure. I know this slide's small, but you guys will get the slide decks later anyway. But if you look at all the sectors, you will notice what is missing. And what is missing in a list of infrastructure is, first of all, there is no human services sector. Childcare is not listed in critical infrastructure. Schools are not listed in critical infrastructure. And human services is not listed in critical infrastructure. And I would suggest it probably should be. Next slide, please. And that takes us where we are to today. And for me, as an academic and a researcher, I always have to have something that helps me wrap my head around the way I see the world. And one way to see it is through a human-centered, structured, analytic approach with children as the end user. And if we think about what we're doing in this workshop, we know that Lori Peek did ethnographic studies of children following Katrina. We know that there are many local, state, and federal agencies, and many of you have presented during this workshop. But we need to identify what is the scope of human services. For us to be able to identify what the evidence base is, we have to continue to have in-depth discussions. We need to know what all the important documents are. And thank you for everyone that shared links yesterday and is sharing and are sharing links today to those important documents which we are compiling. And in many ways, we are doing today stakeholder meetings. You are the people that really have an interest in this issue, and this will help us form the evidence base so that we can then brainstorm what are actionable items. And I always surround these actionable items with the things I learned when I worked at ACF many years ago, which is whatever we do, we must address flexibility and speed, support the states, self-determination, self-sufficiency, and then federalism. So I hope that as we move through this, that we are able to make more progress today.